Let's stay at the Greater Accra Regional Hospital because doctors at the COVID-19 treatment center there are warning the case management facility may be compromised if a dedicated oxygen supply point is not provided immediately. Though the main Ridge Hospital has a dedicated oxygen plant, supply is yet to be extended to the COVID-19 treatment center. So far, 19 people have succumbed to the virus at the facility in 2021 alone. My colleague Manuel Cranting was at the hospital and reports.
A visit to the Greater Accra Regional Hospital at Ridge Wednesday morning will reveal all 16 beds at the COVID-19 ICU there are occupied. Management of the facility had in September 2020 expanded its 8-bed COVID-19 treatment center into a 16-bed ICU. According to medical director of the hospital, Dr. Emmanuel Sorpeño, this intervention has not been enough as the latest spike in the country's active cases has put pressure on the facility.
I say that we opened the new phase of the ICU around September last year, where the place has been relatively quiet. We did not have the numbers until the beginning of this year, when we begin to have very high volumes of cases. The strange thing or the interesting thing is that very critically ill patients in very high numbers. We started the place with 8-bed ICU, but we have had to expand it to 16-bed ICU currently.
With the increasing number of severe and critical cases being reported at the facility comes a growing demand for oxygen and usage of mechanical ventilators. But delivering on this demand is being threatened by the lack of a dedicated source of oxygen to the ICU.
And as we are talking now, all these 16-bed ICU beds are occupied. And one of the critical needs of patients like this is oxygen support. So they have to depend on high volumes of oxygen. As the technical people have said earlier on, very critically ill patients need about 15 liters of oxygen a day, a minute. So you can imagine, just every minute they need about 15 liters. So that means that in 3 minutes, in 4 minutes, they need about 60 liters of oxygen, So this is a high volume. So where we have the ICU located, it's not connected to the main block. And so we had a situation where we have to buy oxygen in big cylinders to give to them.
Lead on the COVID-19 treatment at the Ridge Hospital, Dr. Emmanuel Ahiamble, explains to me how the facility is operating under the current arrangement.
This is the manifold, where we have about 10 oxygen cylinders, which are connected to the ICU. So the way they are, when the oxygen cylinders are empty, somebody needs to come and reconnect them. So now there are 10 of them. So it runs in series. One finishes, then it moves to the other one, to the 10. When the 10 are finishing, then someone has to come and change. So that's what we are experiencing. Sometimes, like I said, there could be interruption to finish, and the person comes to change may not be there on time. So it means those who are in the ICU may not get oxygen immediately.
But as doctors here improvise to continue providing uninterrupted care to patients on admission, Dr. Sorpeño says this could portend a real danger for case management.
Normally we buy oxygen, before when we buy oxygen about 25,000, it lasts us for some time, but now 2 to 3 days is finished because some of the patients have become oxygen dependent and they are consuming high volumes of oxygen. So we have gotten to a situation where we are spending a large part of our internally generated resource on purchasing these oxygen. So we've now realized that our oxygen plant, we have a plant, so the oxygen plant can be connected to the ICU block.
Manuel Cranting with that report. And if there's anything COVID has taught us, it is that we need to be there for one another.